In today's Health Watch, we're looking at a new study about hormone therapy for women during menopause. Researchers found hormone therapy slows the aging process and can we say, benefit women's health. For more now, let's talk with CBS News contributor Dr. Celine Gounder, editor-at-large for Public Health at KFF. Good morning. Huge news for women of a certain age. What does this new study tell us?
Well, they're looking at chronological age, so age based on your date of birth, and biological age, which is not just about how you look, but it's really about your health. And what they found, this is a study of over 100,000 women in the UK, that being on hormone replacement therapy does seem to slow biological aging, which is really significant. It wasn't just, again, about how you look, it was about your risk of death, in particular from cardiovascular disease.
So many women, it's about how you feel. But there are health concerns, or at least the notion of previous studies saying that there were some serious links to some other diseases. What can you tell us about that?
Yeah, there were studies done in about 20 years ago now that have been shown to be problematic in terms of how they were designed. But unfortunately, a lot of women were discouraged from taking hormone replacement therapy as a result of those studies. Now, there are some women who cannot take hormone replacement therapy, for example, if you have a history of breast cancer or blood clots. And so this really depends on who we're talking about, the timing of when to start, and how long to be on them.
And it sounds like it's better for women of a certain socioeconomic status.
Well, aging is also a reflection of your day-to-day stress. So when we talk about somebody having lived a hard life, it's not just a question of smoking or heavy drinking or using drugs. It's also the day-to-day stress of financial stress, worried about keeping a roof over your head, food on the table, your children's futures. And that stress also ages you. So, of course, women of lower socioeconomic status are experiencing that more. Education is also an important factor here, being able to better access health care.
Yeah, well, Dr. Celine Gounder, a lot of women are going to be looking at this new study.